So I was reading this news article that I saw,
On.
and it was about, and it was from, wait, the article was written January 4th, 2024.
Pretty recent.
And I'm just going to read the title to you. Exploding toilet at a Dunkin' store in Florida left a customer filthy and injured, lawsuit claims. So,
Filthy and injured. I'm curious what the injury is.
so I'll tell you.
Okay, let's hear it.
A customer has filed a negligence lawsuit against Duncan, claiming he was injured by an exploding toilet at one of the coffee chains. There's nothing worse than having to be exposed to an exploding toilet at a coffee place.
Where would you prefer to have an exploding
I'm
toilet
just thinking about
prevention?
a place where people's bowels are less stimulated.
I can think of one place right off the top that's way worse, and that's any given gas station across Canada.
Oh, or a porta potty.
So much
I
worse. Yeah, there's worse.
my mom told me this story a few years ago. So Boots and Hearts, have you ever been?
No.
So there was an incident at Boots and Hearts. This was a few years ago. My mom told me this story. It was like a friend of a friend's daughter type of situation was at Boots and Hearts. And while she was in the porta potty,
They tipped
someone
it.
tipped it.
Yeah, that's like a thing. That's a thing.
The
Oh
way,
yeah, that's happened.
the
Oh, that's happened to a
way,
million events.
the way I would die physically. No, when I tell you,
I
like,
would
okay,
have a
here,
shower. Like I wouldn't be happy, but like no one's gonna die.
no,
Just don't
if
keep your mouth closed if that
if you
happens.
get hepatitis, you may. Okay.
Well, yeah. I don't know. I feel
I
reasonable about my odds here.
I'm to the point where I would almost rather pee my pants than use a soiled porta potty.
Come on, no
I,
way. I go
yeah,
to porta potties all the time, like all the time to this
no,
day. Like I play up at the sports complex in this city, and
no,
that's all you have, man. That's all you had growing up. If you
no,
like played sports on the field, like
I didn't.
baseball,
Nope, never did.
yeah.
I would not bring water to the event if it meant that
You would just a baseball tournament of 6 games in a row, and you would just die on the field of
and you know
dehydration.
what? This is why I cannot play sports. This is why I will
Like
never be a
I've pooped in porta potties. Like I don't care.
stop it
Yeah, no, for sure.
immediately.
I'm telling you right now, if I have to poop, I don't care where I am. I was not
No.
the friend. I was not that kid that went to school. It was like, oh, I'll hold it till I go home. I'm like, I'm gonna poop right now. I'm gonna go over there and do this. I don't care. If I was at your house, it would be fine. Like there is nothing stopping this. I will not hold it. If I gotta poop, it's happening.
No, I get spooked. I will use it. So there was a porta potty at it was like an event downtown Barrie, like in the summer. Was it Kempenfest? Maybe. We went and I was like, I gotta pee really bad. So I line up to use this porta potty. And like there was poop in there. And when I tell you I did the
Wait, hold
longest.
when you say there's poop in there, poop in like the poop basin where there's gonna be poop, or was there like poop smeared on the walls? Like let's
No,
different.
it was in the poop basin that there's gonna be poop. And I
It's like three
couldn't
feet down. It's worse when it's in your own toilet. There's so much space.
I couldn't handle it. I was
Well, look
peeing.
at it. Get your
I was
business and get the hell out of Dodge.
I was squatting elevated and I was like hovering over top.
Probably
And
peed over all of your clothes. Like
honestly, the way I was like almost hurling at the pure because okay, there's one thing when the poop is far down and like it's like an open porta potty and everything's poop, but as soon as it gets high and it's like rising upward and then it's like a foot below you, nothing worse.
ask me right now how badly I would want to flip a porta potty with you in it. That's
I
maybe friendship
okay.
terminated. Everything would be done.
You want to talk about
I
where
think
I would
we
bring
would.
an aluminum bat? That would be where I would bring in the. That's an absolutely no
That'd
for
be
me.
the
I would
one time you'd fight back, eh? That would be it.
that my flight would be gone. I would be covered in shit chasing you. Okay, so
Circling back.
this person named Paul is seeking more than $100,000 in a lawsuit filed Wednesday in a state court in Orlando. Of course, it happened in Florida, right?
Of course, it happened in
Claiming he suffered, and you know what, Paul, I'm with you. He claims he
Florida.
suffered severe and
I would
long-term
have been happy
injury.
with just a gift card, man. I don't even think I would have raised this kind of problem.
I would also be suffering severe and long-term injuries, Paul. So
Does he specify the injuries?
after the
He probably just got
explosion,
pink eye for sure.
he was covered in human feces, urine, and debris.
Debris.
What debris has not been covered under
Yeah.
feces and
Toilet
urine?
paper. Toilet paper wads, chunks, if you That's the only thing left. Just
Okay.
toilet paper clumps is what I'm
Following the
picturing.
explosion, let's see. He walked out of the men's room seeking help from workers. When I tell you that minimum wage worker is not helping you.
Nobody's helping you, bro. Nobody's helping you.
No one's helping him. So, hold on. The lawsuit says he suffered bodily injury and he has required mental health care and counseling. I would for sure require mental health care and counseling. I can tell you that for free.
This would be like the story I would tell at parties. Be like, I had this one time. Like, I would tell everybody.
No, like when I'm telling you I cannot, I am dead ass serious. I cannot. Like, it would be the thing that broke me. It would be the thing that broke me. So
this is like, oh, this is officially my favorite podcast episode yet. Oh my god.
everyone's learning about my phobias. Everyone's learning a little bit more about Ashley.
And where you'll find her pooping, I guess. Wow.
Okay.
I mean, that sucks. That's a bad day. Bare minimum. Like, that's a bad day. Side note, speaking of toilets, you know what I like? I have a girlfriend of mine that lives around here, and I kind of like, I got a little self-conscious when I like had the opportunity, but she's got one of those like funky toilets that has like
a bidet.
Is that what they are?
Yeah.
Well, there's like all kinds of like
very European
options, all kinds of digital options, and I kind of, I'm curious about them. I think it's cool. They have all these spraying functions, like clean your butt. And hers, what she did have, and I was like, I think it's just like automatically built in as a toilet seat warmer. And I was like, as a sitter, yes, it was pleasant. You sat down and you're like, wow, I could just hang here.
Yeah.
Yeah. So like, I kind of, have you ever tried one?
No. You know what? I've never tried a bidet, but it's been something that I want to get so we have to reno like all our bathrooms, and it's something that I want to get when we redo our bathrooms. I want to get a toilet with a toilet seat bidet because it's just so much more pleasant and it's cleaner to have like water spray up, and also like toilet paper is really rough. So like it can cause, especially if you're, wiping and there's
this will be better on your delicate butt.
Yeah, better on the hemorrhoids.
Right. Did I tell you about the mystery sprayer in my old house?
No.
Okay, I used to play this game. People would come over to my house and be like, got a game for us. Come down to the basement. They were probably already alarmed. And I was like, I take them into our downstairs bathroom and be like, what do you think this is? So there's this black hose that was hooked up with like a sprayer to the back of the toilet, and I thought to myself, well, this must be like a bidet like situation, but it's cold tap water. So I thought to myself, either somebody messed up or this is not what we think it is, right?
Or it's a cold plunge for your butthole.
So like I asked everybody that came to my house, like for the first time, I was like, hey, what do you think this is? And there was like an ongoing discussion until one day I went to I went to this cloth diaper seminar when I had my son. What? I know. But you know what? It was neat. You got to learn about cloth diapers and the different brands.
They have seminars?
They have seminars in Barrie, Ontario, in case you need it.
Love that.
So anyways, I went to one of these seminars, as I would, and the lady, she busts out this like black hose and this attachment. It's like, and this is how you can clean your cloth diapers, because naturally, if you think about it, particularly toddlers, like they, as they start to eat food, like children have like normal turds like the rest of us. So you
Yep.
would not logically just throw that giant human turd into the washing machine, or I wouldn't advise anyway. So she
Yeah.
busted out this sprayer apparatus. I was like, oh my God, this is it. That's the thing on the back of my toilet. So it's meant to spray off diapers before you throw them in the washing machine to get the majority of the soiling out. So, anyways, mystery solved. So if you see
Okay,
that in a
hold
house,
on. Did Bennett use cloth diapers?
he didn't. I lost that battle in my marriage. Yeah.
Okay, I have to be on your ex-husband's side here.
Yeah.
I have to because like I'll tell you, I it's not good for the environment. I'm worse on the planet, but like if one of my kids, especially like at 2 and 4, if one of my kids poops and it's in their pants to a significant degree, the pants are garbage.
You
So I
just throw them
can't
out,
even
eh?
putting myself put like
So
plopping out the poop.
now, like years after the fact, of course, I had not met my son yet, really. And he's the blowout king, the blowout
Yeah,
king. So
yeah,
when he would poop, like it was always out his diaper, up his back, down his clothes.
yeah.
So now, knowing what I know now, and the pooper I have, I would also not necessarily sign myself up for cloth diapers, but at the time I was like, let's learn more about this. It does seem
I
to be
respect the
environmentally friendly.
decision. I
Correct,
respect the
but
decision.
it's not for everybody. So anyways, ultimately we passed and we just left the sprayer thing there. But we did find out the mystery.
That's crazy because you know what? I would have never gone to cloth diaper education class, and I therefore would not know what the hose was for. So really, I feel like every time I speak with you, we uncover a new fact.
Another layer of this onion that is Ashley Barker. Yeah. Yeah.
Crazy. Okay, switching gears a little bit. I thought this was interesting. In BC, the gynecologists are actually doing a little bit of a shift in cervical cancer screening, and I thought it was pretty cool. I wanted to bring it up, and so the article says again, this was actually published published
Published.
January 10th, 2024. And it says the rest of Canada should follow British Columbia's lead in its new approach to cervical cancer screening. The Canadian Cancer Society and Society of Obstetricians and Gynecologists of Canada says Wednesday. On Tuesday, the BC government announced that testing for HPV will gradually replace Pap tests as the standard screening. We know that HPV causes cervical cancer. And what they're doing is they're going to allow people between the ages of 25 and 69 in BC to order a self screening kit, which they can mail back to the lab in an envelope included in the kit so that we can self screen cervical health.
That's interesting.
What do you think?
Well, like, I mean, how straight? I mean, I like the convenience of it. I actually, the first thing that came to mind actually is I have a couple of patients that have very significant social anxiety, and they have a
Mm-hmm.
really hard time going to their doctors for these types of procedures and screening and things like that. And a lot of them actually will put off their appointments and delay the timelines in which they should be doing these things. So on one hand, I like accessibility to
Yeah.
things and services and procedures and things like that. But then when we put it into a non-regulated healthcare professional's hands, I always wonder, like, will this be done correctly? Like,
I
how
know.
effective will this be? And like, God forbid we don't do something correctly and we miss something. Um, and we don't get these detections in time. Like that's my ultimate concern.
Yeah. And so I don't know the difference personally between this new HPV testing versus PAP, because I know, for example, when I was trained in doing PAPs, not many people know naturopathic doctors are able to
I didn't
do
know
these.
that until you told me that you could
Yeah.
do
So we're able
PAPs.
to do these procedures. We actually are able to do PAPs. It's a fee for service, but we can still do them to people looking. Now, I don't do them much because you have to have the swabs, the setup, the whole thing, and you have to do them often enough, which I find that most of my patients where I am, again, I'm not in a remote location practicing. So I think that people have more access to getting them done regularly. And so I've never really set up my practice to do so. But I do know that when you do the actual pap test, it's called, I think it's called a broom. And essentially it's like it has a center thing in the middle. And then there's like essentially like a bristles along, that's all I can describe it as, right?
Right.
And so what you would
Like
do
a
is you like,
mascara wand.
yeah, kind of, right? So you'd be putting it, you'd put it in and you'd get it to the cervix and then you'd rotate on the cervix to get the proper sample of the cells. Now,
Right.
it's saying here that this at-home kit is a swab that needs to be inserted only a few centimeters into the vagina and then rotated 20 to 30 seconds, which to me sounds similar to the swabs we do for a lot of STIs and yeast infections and everything else.
Right.
It also says the swab does not have to reach the cervix. So the chances of doing the test incorrectly is very small.
Probably slim. Okay, well then I really like that.
And again, if we know that HPV is the cause and we know that someone's negative for like I think this is more of a preliminary. So I think, if I'm not mistaken, they would do this HPV test. And if the HPV test was positive, that does not necessarily indicate that they have abnormal cells, but then would
Right.
further drive them to have a referral to have probably that pap done. It doesn't say that in the
Right.
article, but I'm just,
Putting
extrapolating.
two and two together. Yeah, that would be like a reasonable course of action. And yeah, and if that's the case, I think that that could be a good system because, again, for those that don't live where Dr. Laura and I have, where we do, is there's a very significant crisis of being able to get in to see a primary care provider within any kind of reasonable timeline for things. So anything I think that could offload our healthcare system and streamline some processes, I think is potentially worth investigating or at least looking into further.
Yeah, absolutely. Um, Off topic onto another, women's health related topic for today's episode. I wanted to chat about something that's often asked, and I know, Ashley, you have some personal
Yeah.
anecdotes to add, and that's really talking about fertility and miscarriages and kind of what they're actually testing for when you go. Oftentimes, I see patients who will come and see me and say, I went to Emerge for my, miscarriage, and they tested for everything and it's good. And so I don't know if you want to start with your experience so some people can kind of understand and relate.
Yeah, yeah, and I'm gonna start by saying, I'm really fortunate in that I have a very good kind of medical community around me in that I know a lot of paramedical practitioners and I can reach out to Laura and sort of check and say these tests were done, is there anything we're missing, and blah blah blah. So some people that have worked in fertility settings in different capacities, so I also understand how fortunate I am. But in terms of the personal side of things, I've learned a lot more about fertility and, of course, working with this population over time from my own experiences. So, for those that have not met me and have not had these conversations with me, I have had many miscarriages, four in fact, and I have one living child, and he was really, really hard to get on this earth. And I was one of those people where, chatting with Dr. Laura and what I had been told is like, you've had everything done, you've had all of these testing. And then, when I sat down with a practitioner who has that fertility focused background, she was kind of like, well, actually, was this and this and this and this run. So what I see is a little bit of a dichotomy between what's maybe more standard in on like the medical side of things versus in a fertility specialized side of things. And I have a lot of stories about all of this, and I would like to think that I'm a pretty educated human in general, but there's also just like a lack of communication to the patient of what we're testing and why.
Mm-hmm.
And it's really hard to have those informed conversations. Like, again, so many, we could talk about so many different things here. But yeah, what's tested in the ER versus what's tested in a fertility setting is very different. And I also think there's a lot of there's a big lack of empathy that comes with working with this population. Like, I know I've told
Mhm.
Dr. Laura this, or I'm pretty sure I have anyway, but um, one of the things that's really changed the way that I approach things in my practice is my own experiences. And I'll never forget, I went to go see an OB in town for a follow up after having one of my miscarriages. And we went through the things and the tests and the discussions, and it was very brief, and I kind of wasn't able to get a word in edgewise. And then at the end, as I was leaving his office, he jolly was kind of like, "Come back pregnant," as
Mm.
I was leaving. And I was like, wow, like
Yeah.
such a crazy
Read the
experience.
room.
Read the room, right?
Read
and
the room.
and again, not that this matters. I don't think that anybody under any circumstance would deserve that send off, but when you're looking at things in context, like, I was married at the time. I explained, um the process, of us trying to get pregnant, and investigations that were done, and what I was trying from the fertility side of things. Like, this was like a very intentional process of two people trying to get pregnant and have a baby, and it was just yeah, it was a really wild experience going through all of that. um yeah.
Yeah. And I think also in that experience, there's a lot of assuming that it's all the women. It's all, a one sided problem, so to
Right.
speak. If it were to come up, it's never, the amount of conversations I've had of like, my husband won't eat healthy. I'm like, what?
Yes. Mhm.
We actually know, and I'm sure some of our listeners don't know this, so that's why I'm going to say it is what we know from research is that when it comes to, and I think we're going to talk about this in another episode potentially, but when it comes to preeclampsia and gestational diabetes, we do know that paternal factors play a role. We do know that it's part of the sperm's contribution that influences the risk. This is why we have people who've never had a blood pressure issue in their life, eat well, all the things, get preeclampsia out of nowhere, right?
Right.
So I think it's important to understand the type of testing you can expect at a fertility clinic versus in an emergency setting. And we have to remember, and this goes with everything. For example, patient comes in with headaches. They come to see me. They're like, listen, or they see Dr. Ashley. Listen, I have headaches. I went to Emerge. Nothing's wrong. No, no, no. You went to Emerge. You are not in imminent danger of death or dying,
Correct.
right?
Mm-mm.
So, same thing with miscarriage. They're going to potentially do an ultrasound, make sure it's not an ectopic, make sure you're not going to like bleed out, potentially, do your beta, see if your beta is falling, which is your pregnancy hormone. And that's
Right.
pretty much
That's
it,
it.
right? Unless there are other factors involved, they're pretty much just going to see, is this woman at risk of dying right now? Is there, an infection? Is she, is the pregnancy hormone still there? Is there a
Right.
heartbeat? Like, are we, sometimes they don't even do the ultrasound. It totally depends. It depends on the presentation, right? They're not there to give you a full workup. They're there to see, like, are you living or not? And so that's what we have to really remember in every circumstance. It's not because the ER sucks, it's because that's what their job is, right?
Correct.
Um, this is why we need to go back and see your family doctor, your fertility doctor, all the things. When you go to a fertility clinic, a lot of patients get really wrapped up in that the fact that they've done a ton of blood work at the beginning and the initiation of care. And the reality is, a lot of that blood work, and a lot of patients are disappointed, but a lot of that blood work is like more like paperwork, more like admin. And what I mean by that is, we're making sure we're checking your rubella titers, we're checking your MMR, we're checking your hepatitis, your HIV, your all the things. And the reason why we're doing that is some of those things we will, they'll recommend you get like an updated vaccine or something if your titers are not up to par. The second thing is most fertility clinics are not equipped to handle infectious diseases. So if you had, let's say your partner had hepatitis B or HIV, then they would actually send you to a specialized fertility clinic because they're going to be handling your bodily fluids, and they cannot do that essentially at a clinic that is not equipped to do so. So it doesn't really give us any information about the fertility or your, what could or could not be going on at all. It is a lot of blood drawn, but essentially it's just like admin. So And that's the thing a lot of people don't understand. Okay, so that's the first thing. The second type of testing we'd have would be in the form of a what they refer to as a day 3, which again, to get your period, your when you start bleeding, full flow is day 1. When you start bleeding, full flow is day 1 again. So essentially, day 3 usually it's day 3 to 5. You'll get your day 3 testing. What that is looking at is typically your estrogen, your thyroid, your testosterone, your LH, your FSH. We're looking to see how follicular development is going. Then essentially we would get they would say come back in a couple days for ultrasound, come back in a couple days for blood work and ultrasound. They would, depending on what comes up, right, what they're looking for. Then essentially the next step is to check, okay, are you ovulating? So they're going to watch your LH every few days or so. They're going to watch your luteinizing hormone up, 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 up. When they see it at a high enough level, depending on if you're doing what they refer to as like a mock cycle or like an actual medicated cycle, where you're doing timed intercourse, which is like, essentially have sex on this day, or you're doing IUI, which is essentially where they will actually like turkey baster the sperm in, essentially. Really. So they'll watch your LH go up and up and up, and they'll do what's called a trigger shot, which is in most protocols, because essentially if we see LH go up, it means you're about to ovulate, but they want to make sure that you actually do, so they can kind of take away some of the unknowns, right? Because just because LH goes up, you could also not ovulate, right? So we want to make sure that you actually do. So they'll do a trigger shot, and then you'll ovulate essentially, and then they'll tell you to have intercourse, whatever days, and then they will test. Usually this is called the 2-week wait. They will test again in 2 weeks for the pregnancy hormone, and they'll probably do some ultrasounds, when needed in there. Now, if you are not trying, you're doing more of a mock cycle, then essentially you wouldn't have that trigger shot, and then you would watch the LH go. Sometimes they don't even do that though. Sometimes they'll just do a day 3, and then they'll do what would be ovulation. They'll go about a week after that to test your progesterone to confirm if you actually did ovulate. And then they'll kind of go from there, right? At that point, they're just making a diagnosis.
Interesting.
So
It's
when,
really cool to like, I find that it's just so interesting to me, all of the different variables we can control. It's got to be so mentally exhausting going through all of this. Like, never in my life has anybody dictated when I should have sex. So like
yeah,
that would be something to wrap your head around, just as humans in a relationship and stuff like that. It's
yeah.
wild what we do for kids, man.
Yeah, 100%. And, to watch the mental anguish that, some of my patients have been years and years. And for those who don't know, I actually worked in a conventional fertility clinic for 2 years. So I'm really well versed in what happens from a conventional setting, mixed with kind of a naturopathic setting. And the things that we miss often, again, when we look at miscarriage, it's like when you go to ER or wherever you have to go for that miscarriage, we're not looking at like, why did you miscarry? Let's dig
Right.
deeper. We're just looking at, are you okay right now?
Yes.
And so essentially I find that the things that we miss, things like thyroid antibodies that are not tested, and I see patients who have been trying for years and years and years and have multiple miscarriages and have never had their thyroid antibodies checked, and those are an independent risk factor for miscarriage. So we need to make sure we're testing those things. And also we need to look at sperm quality. The amount of people who are, I'm like, do you have a sperm analysis? Nope. Partner hasn't done any testing. Well, like, that would be my first step.
Right.
Go get
And
a sperm
especially since,
analysis.
relatively speaking, I mean, it's not the hardest thing to obtain. Like,
No, no.
um,
And and as a side note, I've already, so in working just 2 years at the fertility clinic, I saw 2 patients who only found out in the pursuit of fertility that they had a 0 sperm count because
wow.
they were born without a vas deferens.
Oh,
And the only way they knew that was in the pursuit of fertility, because if we think about it, it's not just semen, or sorry, it's not just yeah, that's what I'm saying. It's not
yeah.
just it's there's fluid, right? It's not like nothing's going to come
Correct.
out, is what I'm trying to say.
Right.
So you're always going to see something come out in the
Yeah, and you
ejaculate,
have nothing else to compare it to, right?
right?
So, I mean,
Right.
that's your normal.
Yeah. And so some of these individuals, well, actually 2 out of 2 were born with 1 kidney.
Interesting.
So there's a connection between that. And so you wouldn't know that unless you pursued investigations, right? And so that could be one of the easiest things. Or if someone has a history of, in terms of the male side, if you have a history of having your testicles that haven't dropped by
Right.
when you're young, that can actually severely impact your ability to make healthy sperm. So again, there's lots from the male side to consider, but the question and the health topic was, what are they actually testing for when you go? And so I wanted to make sure everybody kind of had some more information on that. And of course, if there's an additional set of, questions or anything else that you have, feel free to send us messages on social
Yeah.
or whatever else. Okay. Well, ready to wrap it up?
Ready to wrap it up.
Okay. Well, thanks for listening, and we'll see you guys next time.
Bye.